Hello and welcome back to Step Up Med's Cardiovascular Physiology series. In this episode, we'll explore the unique world of coronary circulation, how the heart supplies itself with oxygen, how it meets changing demands, and what happens when that system fails. Let's dive in. By the end of this episode, students should be able to describe the anatomy and flow characteristics of coronary circulation, understand why most coronary perfusion occurs during diastole, list factors that influence myocardial oxygen demand, MVO2, explain the mechanisms of autoregulation and metabolic control, apply knowledge to clinical conditions like ischemia and angina.
The heart receives blood through the coronary arteries. The left main coronary artery branches into the LAN and circumflex. The right coronary artery supplies the right side and part of the conduction system. Coronary veins drain into the coronary sinus, which empties into the right atrium. One key feature: these are mostly end arteries, meaning blockages can lead to infarction with little collateral compensation. And while most tissues extract about 25% of the oxygen delivered, the heart extracts up to 80%, even at rest. That means any increased demand must be met by increased blood flow, not extraction. Unlike other organs, most coronary perfusion occurs during diastole, not systole. Why? Because during systole, contracting ventricular muscle compresses the coronary vessels, especially on the left side. So in the left ventricle, flow is lowest during systole and highest during diastole. In the right ventricle, this effect is less pronounced. Clinically, this means that conditions like tachycardia, which shorten diastole, can reduce coronary perfusion and worsen ischemia.
Coronary flow is tightly matched to oxygen demand through local metabolic control. As demand rises, cardiac muscle produces adenosine, CO2, H, and other metabolites. These trigger vasodilation, increasing blood flow. This is largely independent of neural input, unlike other vascular beds. However, sympathetic stimulation does have some effect. Alpha receptors cause vasoconstriction. Beta receptors cause vasodilation. The net effect depends on the balance between these. The coronary circulation autoregulates between a mean arterial pressure of 60 to 140 mm of mercury. Below that, flow drops, risking ischemia. To understand oxygen demand, remember the mnemonic, HR times BP times contractility times wall stress. Let's break it down. Heart rate, higher rate means more contractions, more ATP needed. Blood pressure, afterload, the heart must pump against this resistance. Contractility, stronger contractions use more energy. Wall stress, explained by Laplace's law, wall tension equals pressure times radius, 2 times wall thickness, so, up pointing arrow pressure or radius equals up pointing arrow wall stress equals up pointing arrow oxygen demand. Up pointing arrow wall thickness equals down pointing arrow wall stress. Clinical example: in left ventricular hypertrophy, wall stress decreases, but oxygen demand remains high due to increased muscle mass.
When oxygen demand exceeds supply, the heart becomes ischemic. In stable angina, fixed coronary stenosis limits flow during exertion, but rest restores the balance. In unstable angina, or myocardial infarction, plaque rupture, or occlusion, causes decreased supply, even at rest.
Let's review. Coronary perfusion happens mainly during diastole, especially on the left. The heart has high oxygen extraction, so increased demand must be met by increased flow. Flow is controlled primarily by local metabolic factors. Oxygen demand is increased by HR, BP, contractility, and wall stress. When supply can't meet demand, right pointing arrow ischemia, angina, or infarction. Now let's give this quick question a try. Which of the following most limits coronary perfusion during tachycardia? A. Increased contractility. B. Reduced systolic pressure. C. Shortened diastole. D. Vasoconstriction of coronary arteries. Leave your answers in the comments below.
Thanks for watching this episode of our Cardiovascular Physiology series. Up next, regulation of blood pressure, the baroreceptors, kidneys, and everything in between. Be sure to like, subscribe, and check out the full playlist for more high-yield physiology made simple.